Mental disorders vary greatly in how they affect the individuals who have them and how they might appear to an outsider. They may be so mild as to be almost unnoticeable, or so severe that they affect an individual's ability to function normally. Because of this variability, and because mental disorders are difficult to see, they remain shrouded in mystery for many people. So, let's start with what we know and what we aren't sure about. How would you define mental disorders? What causes them? Are they influenced most by how we are raised or by our genes? How treatable or curable are mental disorders?
A mental disorder is typically defined as being a behavioral or psychological symptom or pattern that's associated with significant amounts of distress or disability. And particularly, we think about this in terms of impaired functioning in their normal social lives or professional lives. And it's important to note that any context that we want to discuss a mental disorder in is going to be relative, right? So there are different norms by each culture, for each society, depending on where you live. Certain things are normal, other things are not normal. So the context is always important when evaluating anything we want to say is normal or abnormal. But in general, we know that psychological distress and impaired functioning is a key feature of most mental disorders. In general, we can't say that anything in particular causes mental disorders. So what we think about now is more risk factors and what might leave people more predisposed. And there are three categories of factors that may contribute to these risk factors. They're biological, psychological, and sociocultural. It's tough to say whether something could really be preventable in that we don't really fully understand the true root cause of a mental disorder. We know that certain individuals may be less predisposed than others. People develop things like resilience or certain other types of coping mechanisms that allow them to perhaps cope better with certain adverse events in life and thus be less likely to exhibit signs of mental disorders. But certainly there are a rich array of treatment options available for just about every disorder. And so individuals should also know that if one particular type of treatment option doesn't work for them, it doesn't mean that they can't be treated. It means there are other options and maybe something else would be a better fit for them. A different style of therapy, a different therapist, perhaps a different type of drug treatment. So we do have a lot of different options in our arsenal for treating mental disorders. As far as saying whether or not something's curable, again, it really depends. It depends on how well the individual adapts and takes those skills that they may learn in therapy and is able to use them later in life and draw on them to cope with other adverse events that they may experience. So again, there's no one right or wrong or saying something's curable or not. It really depends on the individual and on the disorder. We know that genes do play a role in certain mental disorders, but it's tough at this point to understand fully what the role of genes are versus our environment versus the other experiences that we have. So for certain conditions like depression or schizophrenia, we know that there are genetic links. We know that the odds are slightly higher for individuals who have parents with any of those disorders. We don't know exactly what might lead one individual with that genetic history to exhibit signs of depression versus another, but we do know that there's a predisposition or a risk factor there. As we start to understand better the role of genetics in risk factors for these mental disorders, the better equipped we'll be to help individuals with potential risk factors develop appropriate coping mechanisms. An individual's upbringing can certainly play a role in how likely they are to exhibit mental disorders at later stages. We know, for instance, that children who are raised in homes where there's a lot of marital discord wind up showing more signs of aggression towards their peers. They can wind up being bullies. So certainly we see our parents and we model that behavior. We learn from our environment. That's not to say, again, though, that we're inevitably destined to act just like our parents did. As adults, we can be aware of those patterns or those predispositions or habits, and we can take steps to change them and address them proactively. Well, it's hard to say something is normal or not normal because normal is really a relative term, right? What's normal in New York City certainly wouldn't be considered normal in many cases if we look at Omaha, Nebraska. But from a psychological perspective, when we talk about what's normal behavior, we're really referring to healthy adaptive functioning, both at a professional and personal level. So does the person have a healthy degree of relationships with their peers, with others in their environment, with family, friends? Are they able to, go to classes or go to their job and perform at a reliable, consistent level day in and day out? And as far as normal, also the most important thing is what's normal to you. So you know yourself certainly better than anyone else does. And if you start to notice that, for instance, every day you're feeling a little bit down, or you don't have interest in doing things that you used to like to do, you don't really want to see your friends anymore, or everything starts to feel like hopeless or sad, then for you, that's not normal, and you know that, and that might be an appropriate time to consider talking to a professional.
It's clear that many of us have questions and concerns about mental disorders. Do you think someone you know has a disorder? Do you worry that you might? And if so, what are the options? Fortunately, thanks to a great deal of research, there are many good answers to the questions you might have, and many good therapy options available. We'll be exploring the diagnosis and treatment of disorders and explaining how to find help if you need it.